Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists.
Hello, everybody. It's Monet David, licensed professional counselor, and you two introduce yourself. Whitney, you go first.
Whitney Storey, licensed professional counselor.
And I am Keisha, Katie Holmes, licensed professional counselor.
We did it again, Keisha. We didn't put our extra letters, and we worked so hard for those letters. I forgot ADHD, CCSP. Whitney, do you have extra letters?
Not currently.
Okay, but you're working on it. And Keisha, what are your extra letters?
EMDR certified, but I don't actually do EMDR anymore, so it's kind of
I'm sure you hate that I keep making you say that, and then you have to give the caveat. But I mean, we work so hard as therapists, so I want that to count for something. Today, we are talking about discomfort in the therapy room, and this came from our previous conversation with Keisha and I about exposure response and prevention. Is there an and in that? Exposure response? Okay. And that was with your OCD work. So you should check out that video. But to kind of catch everybody up to speed, ERP necessitates a certain level of discomfort in order for it to be effective. And so then we started expanding upon the idea of what is discomfort in therapy and what are the considerations around it. And so we wanted to talk a little bit about that today. And I think we would be remiss without acknowledging that we are three white, cisgendered clinicians. And so we arrive to therapy with a certain level of comfort. We look like a lot of our colleagues. The profession is predominantly white female. And so we want to always be checking in with ourselves clinically to make sure that we're not promoting discomfort in a microaggressive way or in a way that truly harms our clients. With ERP, it's such a good example. I'm going to run with it. It's not harming the client, but it is creating a level of discomfort for inhibitory learning. And so there's a therapeutic value attached to it. But we wanted to kind of, again, expand upon the idea of discomfort in therapy. And so I kind of want to ask you to, when you think about discomfort in the therapeutic setting, maybe starting out, like, what's your experience with that? And if there's any insight.
I can go first, I guess. The main thing that I was thinking about is that discomfort is such an essential part of therapy. I think for the way that I think about therapy and the way that I do therapy. So using the language of the foundations that I have, which is acceptance and commitment therapy, or ACT, discomfort is required almost in order to then be able to practice the skills of psychological flexibility. So the idea with ACT, and the reason why I love it so much, is that the thing that causes the majority of our problems, if we're talking about diagnosis, is the idea that we get really rigid and stuck. So getting out of something where we are rigid and stuck is inherently uncomfortable. And it causes us to become more psychologically flexible. But it's really interesting. I mean, this has come up with clients sometime, this idea of wow, I've seen you 3 times, and all 3 times we've done really, really hard things, and you felt a lot of feelings. How is this going? Is this what you expected? So it's really complicated.
It is, isn't it? Keisha, what's been your experience? Okay, so you work with OCD and you do ERP, but even beyond that, what's been your experience with discomfort?
I think lately I've just been so aware of how people come to us and they want it gone. Get rid of my anxiety, get rid of my depression, get rid of my trauma. And I probably naively bought into the idea with trauma work at some point that I was going to help these people get rid of it. And then after doing work for so long, you realize that's not how this goes. There's a bunch of acceptance that has to go into this. And I love ACT because of this idea that like we are trying to help our clients like feel like they can navigate, and not that they won't have feelings. It's that they're going to have them and they're going to learn to have them and then bounce back. Like that resiliency. I always do the rubber band in my office, it pulls back. Now, what's your pillow that's going to help you push back forward? It doesn't mean we don't suffer. Suffering is a part of this. It's just how do we rebound from it?
Ooh.
That's
Yeah.
so interesting. There's two things, like this idea of, and it's kind of a joke, ACT likes to use language to like do all kinds of fun things in our brains, but with ACT, with psychological flexibility, it's not about feeling better, it's about feeling better. Which I just love that silly little stuff. But it's so interesting, like Keisha, you were just saying, this idea of like we're not going to suffer, because I think that's one difference in the way that I think about therapy too. And this might just be autism coming in and like taking words so rigidly and specifically, but I don't know. I think when I think about living a life that's like congruent with my values, it's more like I'm probably going to feel pain, but the hope is that I won't have to suffer. So like that difference between the pain and the suffering is interesting.
Yes, that discernment, that resonates for sure. And I think it makes it way more palatable for a client to understand that there will be a greater purpose, perhaps, where it's been feeling so endless and hopeless. It's like, well, if we commit to this process together, it's not that it's going to be easy, but it'll be worthwhile.
What, and I will say, as a clinician, I struggle with what is the end goal, because it's
Mhm.
like, I don't want to say you're going to feel better because you might
Mm-mm.
not. I don't want to say you're going to be happy because that seems like I'm selling a bill of goods that I can't guarantee.
Mhm.
So these words of like, it'll be worthwhile, it's so open-ended, right?
Yeah.
Worthwhile is an open-ended word, and it allows for whatever that process to be, the end result to be, right? Yeah. The word thing, the words we use, I'm like, yeah, I'm so ERP. I'm like, so we suffer. Okay, we suffer. Let's lean into it. So we suffer. What's the worst thing that can happen in the suffering? Um, but it doesn't matter how we get there, right? All
Yeah.
these things I think are trying to create that psychological flexibility. Even Monet's word, it's open-ended, it's very relational.
Mhm.
Um, and it's trying to get that same end result. Yeah.
I I'm curious about the connection between this idea that we are owed comfort and white supremacy. Whitney, I feel like
I
bouncing it
mean,
to you, because
yeah.
we know that there's this connection there, that the goal is to always uh, seek comfort. Um, but in the context of white supremacy, and you can correct me if I'm wrong, it's like it's very pathological in nature. It is the assumption that one should always be comfortable, um, to the exclusion of perhaps growth. Um,
Yeah,
what do
growth on a small scale, like at the individual level, and also growth on a larger scale, culture. Um,
Mhm.
yeah, and when we look at the like characteristics of white supremacy, right to comfort is one of them. It's one of the 12. Um, and I think this shows up, and it's almost, it's a tool, right? It's a tool that we learn to use. And I think what's so tricky about it, as a human being, and again, this might just be like my very autistic way of thinking about things, we learn really quickly, really easily, like, I feel bad, I need to fix it. And that skill isn't necessarily a bad skill. We learn, hopefully, like I'm thinking about my preteen daughter, we learn like this person, when I'm with them, I feel bad. I want her to figure out that like that means something, that's meaningful. Um, but what happens is that our very inflexible brains then take this to a larger scale so that our brains figure out every single time I feel bad, I feel uncomfortable, I am being harmed. And so I have to like fix it. And usually because we're very simple creatures in this moment from fight and flight, like in my case, turns out I am a fighter. And so I will just attack, attack, attack. We also hear a lot in, in social media and the culture about like white women's tears. Like that's another totally normal response to feeling that fight and flight and feeling uncomfortable and feeling like you're being harmed. But we don't deserve comfort. We don't have a right to comfort. And like we've been saying this whole time, like if you stay comfortable, you're not changing, you're not growing, you're not relating to other humans. Like being in a relationship with another human is painful, period.
Whitney, I'm so glad you said fight or flight. For the uninitiated, Keisha, since you're like our resident expert, can you just give a brief little explanation of what fight or flight is like in the nervous system? Because I feel like when we're talking about discomfort, we're probably witnessing in real time for our clients, they are going into fight or flight. Their nervous system is dysregulated. So if you could just like explain it a little bit.
It's a trauma response. So, and it's a unconscious process. Your nervous system just takes over to keep you alive. It goes into fight, flight, freeze, fawn. Flop is in there too, which is a new one. And it's just there to protect you. But so most people come to therapy talking about the fight, flight, freeze kind of responses. Like that's the problem. Um, but it's just a natural thing that happens. And there's no judgment about it, right? Yeah. I do. And I want to say, I think as therapists, we often look at the process as about our clients. We're just like really focused on them. But I think that we are having our own reaction to discomfort, right? It's discomforting for us to see someone in discomfort because of
Yes.
our own stuff, right? And our own trauma response that can be happening. And so looking at our own reaction in the therapy room is so, so helpful. Um,
More about that. What have you picked up on your own experience? Because I feel like this is something you've really been considering lately.
It's such a subtle thing. So I've been a therapist a long time. I can mask, I can hide, I can brace against without people seeing that I'm bracing, but it's these subtle body postures when I'm uncomfortable.
Mhm.
Um, and I'll often describe it like my client isn't receptive to the process or whatever it is, but I am starting to look at what's going on with me that maybe I'm giving off this subtle air of tension
Mhm.
that maybe I need to like own my discomfort. I think it makes us better therapists. I mean, some of the stuff we're talking about, like white supremacy and doing the right thing in therapy and no harm, these are the things that we're taught to do. When you go against that, it can feel wrong, even if you think you're doing the right thing and you were trained through ACT or ERP to do it this way. There is this discomfort that we have to own.
So I'm hearing that processing for you in the clinical role is happening in real time and it's happening after the session. It doesn't just stop whenever the session stops, but you're also taking in all the data points that you've observed in yourself. Um, how does that inform the next session? Is it being really intentional when you arrive to know that you had some sort of response previously? Is it consultation with other therapists? Like, is it even like solution seeking, or is it just staying curious about it?
That's interesting. So I just recently came to this awareness. So I'm going to do trauma work on it.
Okay.
That's my like way of treating it because I think it's unconscious. I don't think I'm doing it on purpose.
Mm-hmm.
I get an idea of what a client needs and I do it, no matter how uncomfortable it makes me. I don't always think that's bad, but I think I should be aware of my body and do my own work also. It's too
Mm-hmm.
idealistic to think I'm just going to address this and I will only address things when I'm relaxed. Like that's not how the human experience happens.
Yeah.
So my answer is trauma work and awareness, but I know Whitney's going to have a different answer. So Whitney, what's your answer?
Oh, of course, my answer is going to be stupid and annoying. It's all of those things. It's like continuing in the moment, pay attention, for me, it's like collecting those data points. Like if it's a one-off thing, I might like mention it if it feels particularly impactful or like weird or different in the moment. If it's a one-off thing that is just like, meh, then I might just leave it alone. Probably gonna be talking about it with people I trust. Like I think it's all of it. It was making me think, Monet, like this, I was thinking both about like, you know, Keisha, with your years of experience and then doing classes and having clinicians asking questions in some of our classes that feel very much like, I care so much, I want to understand, what do I do? And how that's so similar, I think, to the clients that come into the therapy space. And I think what I'm really leaning on a lot lately is this idea of therapy is healing. Therapy works because it's relational. And I think, Monet, that's like such a skill that you have as a clinician.
Mhm.
What does all of this stuff with comfort look like for you and your clients? And
For me, it's bearing witness to the discomfort. So I feel like I do a really good job of attracting people who I call them like misfits. I consider myself a misfit, like aren't necessarily existing in the world as the people would want them to in their lives, right? So there's been this messaging over and over again of like, you're not who I wanted you to be. And that is disappointing. And so it's like all this internalized stuff. And so being able to bear witness to that and like themes of rejection and disappointment, it is a lot of pausing and intentional pacing for me, the discomfort. It's often in the real world, like therapy is not the real world. Outside of therapy, people will express these emotions of like, man, I feel like I'm just not good enough, basically. And the people in their life who care about them, like, oh yes, you are. Don't worry about it. You are so great. You're so great, right? And in the therapy setting, it's like, what does it feel like to say that out loud? Because I know it's being like you're shouting it in your head 24/7. Any sort of perceived misstep or faux pas is just saying it over and over again. And so it's kind of like facing it head on. So instead of being chased by it, it's turning around and just kind of standing up and witnessing it. And so I feel like that's how discomfort shows up. But I also have been employing this new technique that I think does promote discomfort. And what that looks like is asking a client, what are we not talking about? And
Mm.
just seeing, because sometimes they've been waiting. They've been waiting for me to like just suss it out of them. For other people, it's like, oh, what am I really not talking about? And I see the wheels turning and everything. But to kind of like peek around the bush and be like, okay, we've been really addressing these things. And yes, you wanted to be here for that, but I suspect there might be something else going on. And what are we not talking about? And that has been really interesting in session.
I'm sure, Monet, I'm like sex. It
Yeah.
opens the door, for this like we're gonna talk about the hard stuff, but
Hmm.
it's so relational. Even your practice of facing it, I'm like ERP, like you're mindfully facing the
Yeah.
discomfort with the pause in moment. This
Hmm.
is like the art of therapy that's if you don't know how to do it, you just don't know how to do it. Do you know what I mean? It's like something about who you are as a human that
Hmm.
knows in those moments to be intentional in that way. It's really beautiful. Yeah. I don't even know what else to say about it. It's just so beautiful. It is the art of therapy. I love
It
it.
is. And I think everybody here does it really well. I think everybody's willing to embrace the discomfort, and for the purpose of seeing what happens. Like there's curiosity attached to it. And I will say, I'm really proud of how you and I, well, all three of us as leaders, when there is discomfort in the context of leadership within a mental health practice, we immediately are like, this is a growth edge. How do we like face it head on? There isn't this avoidance. Maybe subconsciously in the moment, we're like, oh, that feels weird. I don't know if I like that. But in consulting and processing, and then through the creation of how we want to address it, there is this real commitment to discomfort for the sake of growth. Do you feel the same way, or do you feel like it's any different?
I do. You talking about to me right now? Yeah.
Well, to both of y'all in leadership positions within the company, just like from, so this context would be from like supervisor to supervisee, from clinician to clinician, not necessarily clinician to client, how we embrace discomfort in that context.
I will say some massive, massive growth edges. I am a effing avoider. I'm trying to say
Mhm.
that word. I am an avoider by nature. I do not like conflict. I don't like people unhappy. In the controlled setting of my office, when we are doing a protocol, I can do it. But if there's like somebody gets upset during the process, that sits with me. There's like two forms of discomfort, and somebody being mad at me, I cannot tolerate. So, yes, growth edge. We are trying to be better as humans about that because we want
Mhm.
our organization to be healthy. I
Yeah.
do I do think the accountability piece in having shared leadership, for me, I love that. It forces me because if I was on my own, I probably would just avoid conflict. But because if I avoid it, it will harm one of y'all, I'm more likely to address it for that alone.
Mhm. It's like a
Yeah.
systemic thing. Like you can take and take and take if it was just you, but because other people within the system could be harmed, that's enough to push you to just do it.
Yes. What's your thoughts, Whitney? I
I
know.
was thinking back to like just starting, and how, and I don't think this is an unusual story, even if people are not from our area, like, the amount of use and abuse that like new clinicians experience in the field when they first get in the field, and how that teaches you, consciously and unconsciously, all that fight and flight kind of stuff, picking up on cues in new environments, and learning how to trust leadership like authentically, and what you can trust leadership with. Like I think back to even like the very beginning with when I started at KDH, and like, our neurotypes are different, and interpreting texts and panicking and like being able to like check in and be like, oh no, this is what's up. And it's like, oh, okay. And now I have like a framework for it. But like that inherent fear and distrust that I think a lot of new clinicians have can make it really difficult when you're in an environment where like everybody really is really focused and values learning and improvement. You know what I mean? It feels unsafe.
It's
It's
fascinating.
it's super disarming, and I'm laughing because I can't tell you how many times I have had to reassure people Keisha means what she says. She's not like she literally means, "Oh, okay," like, and it's not a, "Oh, okay," like you can take her at face value because what she's saying is what she means, which is really sad. But like it's indicative of what you mentioned, like just the state of the profession.
Mhm.
It's very disarming for a lot of people to come to this practice because we try to be so transparent and respectful. They're not used to it, and they're very shooketh about it, right? And so it's this process to like trust, like, yeah, we mean what we say, like that's 100%. And yeah, so I like this understanding of discomfort in a professional capacity of like, ooh, yeah, there's been maybe some exploitation in my work history and I don't know what to make of this, and is it uncomfortable? But for you, the discomfort was quickly dissipated, it sounds like, because you were able to confront it and say like, is this what you really mean? Is this like, are you really saying these things, Um, Keisha, because you've been working the longest out of the three of us, what's been your experience with discomfort in the profession? Like, I'd love to hear your experience with that.
Y'all, this is where I have to say my own trauma history. I was probably a bit naive. Um, if someone was a therapist, I just assumed they were good, nice, kind. I had this idealization of us like we were inhuman. I recently told a client about this, but I don't know, there's this idealization that we're all sweet and kind and always nice.
Yeah.
And we are, a lot of us are like certifiably nice, but I worked for the military, and I remember a lot of the therapists I came in contact with were so mean to me. In terms of like, who do I think I am? I'm so young. I shouldn't have this job. Like, only people who had been seasoned should be in this sort of role as a consultant. Anyway, it was crazy for me. And there is this like kind of thinking in our profession that certain people know more than others. God, I don't even know how to break that up. That's probably some white supremacy shit or something. I don't even
It
know.
is.
Yeah.
Okay, figured. Yeah, yeah. Which one is that on there?
It's I can't remember like the short way to say it is basically the idea that the people in power are in power because they know more, they know best, and they've like earned it in some way. And so like time in the field equals power. You can't become an LPCS until you've got this much time in the field. You can't be on leadership in an organization until you've been in the organization for a long time. And it directly contradicts research too. Like there's data on this of like what therapists are better therapists, and it has nothing to do with how long they've been therapisting. So it's so silly.
I love that.
I love your brain.
Yeah. And I do think there is like experience makes us just different. It's crazy. Like the things that I thought were helpful early on, I was going to be a play therapist, right? I'm not a play therapist, obviously. I'm very different now. It's been a journey. But remaining open through that process. I think it's when people who have experience think they know it all, that's when they've lost whatever that is.
That's exactly what I was thinking. That idea posits that all experience is created equal. We know that, so for those who don't know, we have to get 40 hours of continuing education every 2 years. There are therapists who wait till the very last minute, cram it in, and they call it a day. And then there are therapists, which I feel like we are, where we are really seeking opportunities to grow and develop as professionals. So I may have more knowledge than somebody who's been practicing twice as long as me because I do value that aspect of the career, and not everybody does. So it's like not all experience is good experience. Sometimes it's just experience, and you could be practicing very poorly and badly, which we know exists in this sphere of the profession. So
And maybe too, not just the idea of like thinking you know it all, but like also knowing all of it all, if that makes sense. Like I know if I have a question about like sex education kind of stuff, whether it's for a client or for my own kids, like I'm texting Monet because she's done hours and hours and hours and hours of learning and is still learning that. I wouldn't come to Monet to ask about like
math. No, I'm
so
just kidding. But
math.
like math in general.
I don't know. I don't
I
even
don't
know
know
what
anything about
gardening. I wouldn't come to
ERP.
Monet to ask
Yeah.
her questions about like how do I keep my basil alive? Because I don't think
Mhm.
Monet cares too much about keeping basil alive. You know what I mean? So,
Yeah.
and I think it's the same thing with therapists, like therapists claiming overtly and covertly that they have experience and learning and competence in too many areas. Which I think the idea is, and maybe this is the academia in me showing, the idea is that like the longer you're in practice, I think like in theory, the more and more niche you get.
Mm.
So I don't know. It's
Yes, yes. We can't be experts in everything because then we're not experts. I mean, this is stuff I started saying early on. It's a pet peeve of mine. And if we are doing a really good community sort of shared clinic, however you want to say it, counseling experience as professionals, we are going to lean on people who know more than us. That is the only way for our clients to get better because if we give them poor care, they think they're untreatable, and that's our fault. That's on us, right? And that is my pet peeve about our profession, right? So I think we're bringing up some really good points about white supremacy, which I honestly, this whole theory you guys have introduced me to, I'm not online that much. I know what I know and I read what I'm interested in. So it is very specific, neurodiversity,
Mm.
OCD, sensory different, you know what I mean? So I love that y'all can bring these ideas that are more I don't want to say like social media influence, but it is the feeling of younger people. This is like the content that comes from people younger. I'm 48. We don't talk in the same sort of ways. And I love that. I love learning from y'all.
It's really valuable to be able to externalize phenomena as like, and that's a big basis of my practice is like we often think it's personal deficits. We're such a ruggedly individualistic society that we think that any sort of flaw or deficit is due to a personal failing. But when we start piecing apart the messaging that we receive and the influence that that has on us, it can be really liberating for people. It's suddenly me versus myself, and then becoming me versus the man, me versus white supremacy. And that feels much better for a lot of people to be like, oh yeah, I gotta stop internalizing this because they want me to internalize it. Like I'm a big fan of like they've commodified a lot of our, and they being like the powers that be have commodified a lot of the things that we're self-conscious about, right? There's money to be made off me not feeling good about myself. And so for some people, for their brains, it's like, yes, I'm getting rid of that. I'm eradicating that. I can't let that bother me anymore. And that's really fun. And I think there's action implications from that. And if anything, it just plants the seed, like, oh, am I feeling down because I saw 6 advertisements for this one thing that's going to make me the best person ever? And so subsequently, because I don't have that one thing, I'm not the best person ever, like piecing it apart in that way is really fun. But
Monet, but you're
yes.
you're going back to the idea of discomfort, right? So if
Mhm.
we as therapists are selling some, you're going to get rid of this, right? That's what we're
Mhm.
selling. We're going to get rid of your anxiety. We're going to get rid of your depression. We're going to get rid of it.
Yeah.
Then we're getting our clients to chase something that's unattainable.
Yeah,
It's fascinating how it all kind of goes back together.
it really
Yeah,
does. It really does.
understanding it from those like systemic levels and everything. Also, I don't know, I sometimes I find it like it's like a technique in the moment to like make the discomfort a little less in my face or in my client's face, where it's like, oh, there's capitalism again, and it
Mhm.
pauses like enough space for them to be able to like feel the discomfort differently, longer, than when it feels so personal, like you were talking about, Monet.
Yeah.
It's
Yeah.
so it's so helpful.
It is. Discomfort has its value. And I think about, we even kind of speak to that in our declaration statements that nobody ever reads because they're so long. But one part of it does acknowledge like
You
there's,
might not feel good.
yeah, you may leave feeling pretty awful. And that doesn't mean that it's not working. It means that something is happening. And I'm not the best about addressing that. I feel like I do so much info dumping in the intake session to kind of prepare them that like that doesn't always make it in there. But sometimes I am able to get back around it in the beginning sessions to be like, sometimes growth means leaving other people behind. And that's really hard because you are committed to yourself and your growth, and other people are maybe still in their own stuff. And so it may be really uncomfortable because you're going to start seeing patterns that maybe you weren't privy to before. And you're going to see them so clearly because you've done the work in here that like there might be some decision making down the line. And that's me being like super ominous, but it is a theme. I mean, we talk about, at least anecdotally, in the grad program, at
Mhm.
least 1 or 2 people are getting divorced when they're in grad school to become a therapist, right? Because there's so much personal development and work that like relationships don't make it sometimes. And that is uncomfortable to think about. But it would be, again, we would be remiss not to acknowledge that sometimes it's uncomfortable.
Mm-hmm. So
Yeah.
what's our takeaways from this, guys? This is some good stuff.
Mm. I think if you're not feeling uncomfortable, if you're going a really long time in therapy without feeling uncomfortable, it's worth bringing up. I think it is worth like, I got to agitate the system. And I think the responsibility is on both people, the therapist and the client. Like, yes, we want to feel good and we want progress to happen, but we also, again, I love that idea of like just agitating, and not like agitation, but like, like what are we not talking about? What have we not highlighted? I think that I had a client who's like, if you don't piss me off after a few sessions, then we're not going to work out. I want to be pissed off. I want you to say something that upsets me, because typically that gets me moving. Which felt like a dominatrix sort of situation, if I'm being honest. It was like, I don't want to bring you pain, but I got where they were coming from. They needed me to call them out. And I've had clients who have been like, you need to call me out more. And I'm like, if there were things to call you out on, I would have called you out on them. You're being really hard on yourself, but noted, if the opportunity presents itself. But that's not a bad thing to solicit from your therapist.
No, I love that. And I think I was thinking about like several different clients as you were even talking. Like there's some of them where like we talk and I will share with them like, you know how I'm gonna know when like you're getting close to graduating is when you make me mad in session. I'm like, oh my gosh, I can't wait. You're going to be like so you that it's gonna irritate me. And I'm gonna be like, oh, therapy done. And then the other thing I was thinking about is because I'm so naturally like a poker, on purpose sometimes, but also not on purpose. Thinking about like being intentional, like giving people heads up ahead of time. So like in sessions with clients, being able to say like part of my job is I'm gonna like poke at stuff. You get to say none of your business. That's great, love it. Stand up for yourself, make me angry. I would love it. But that's part of my job is like poking at stuff and seeing what happens. So heads up.
I love that. So, and I do a similar thing, Whitney, in terms of like I poke at it and then I like back off and then I'm like, and maybe it's a point that I know will upset them. Like, do you think that's controlling? I'll say something, right? I'll have something where I'm like, I might put a negative spin. I see if it sticks. If they just kind of float over it and it's like a pattern in their life, where I'm like, maladaptive, maybe not good in relationships, I'll bring it up again. And I don't do it on purpose. Y'all have to know this is just because I don't like upsetting people. So I poke at them and I wait and then I poke and then it just keeps coming and then I poke more and more until we get something going. Or I'll tell them to brace like, hey, I'm about to say something you're probably not going to like. And that normally makes people, it's fascinating. They'll like, I don't know if they pretend they're not upset, but they'll like, kind of get in the posture that they're ready to hear it. And then I tell them whatever it is. And then they seem to take it better. Look, this relational back and forth, whatever this is that we're doing, that rubber band, it's the rubber band. Um, that is attachment. That is what people come to us for. I don't think attachment is just comfort. I don't. I'm going to say that right now. I think attachment has a bunch of dynamics in it. And people are lacking attachment, which is why they come here. I do think so. Yeah.
Agreed.
Wow.
Oh, this was good.
Wow.
Thank you so
Okay.
much.
More to come.
Yay.